All right, I did my research on integration of different psychosocial interventions in survivorship care and their effect on long-term psychosocial outcomes of young adult Hodgkin lymphoma survivors. Just for some background, Hodgkin's lymphoma is one of the leading cancer diagnoses between ages 15 and 39 and is the leading cancer diagnosis between 15 and 24 years old. The current survival rates between 85 and 90%, which is huge for cancer in general, but specifically Hodgkin's lymphomas. They come a long way over the past few years in treatment advancements. However, this has left a huge population of survivors that are struggling to navigate mental, emotional, and social normality. This is specifically difficult for the young adult population as their cancer diagnosis often interrupts normal milestones that occur at this age, including navigating schools and careers, goals that they've set for their life, family planning, relationships with significant others and family members, friends, things like that that are already hard to navigate in healthy individuals at this age. The most common psychosocial issues among survivors that have been identified are depression, anxiety, quality of life, social support, social reintegration, and fertility concerns. The significance of this research is what I've already listed, just the difficulty of navigating it at this specific age in general, the disruption of their goals that comes with cancer diagnosis, social bonds, family lives, loss of reproductive capacity, which is extremely particular to this Hodgkin's lymphoma treatment and instills a lot of fear in this young adult female population specifically. Current medical follow-up care focuses primarily on physical health without any integration of psychosocial interventions, kind of robbing them of opportunity of this holistic approach. But then interventions have been used in other studies, these psychosocial approaches that have shown to be effective and give us a lot of hope of their use in this specific study as well. The 2022 study I have listed here really puts numbers to these exact reports of issues that this age group is struggling with, kind of bringing a clarity of how many people in this population are actually being affected. The gaps that this research addresses is young adults. There's a lot of research out there in pediatrics and adult population, but nothing specifically addressing the psychosocial needs of this age group. Hodgkin's lymphoma is an understudied cancer as a whole. Long-term psychosocial recovery, there's not a lot of longitudinal studies that put their work in to understand what these psychosocial effects are that come from the treatment they endured, but more importantly, the recovery and how they resolve those issues. And the most effective type of interventions are being seen in other studies, but there hasn't been one declared to be most effective to incorporate in survivorship care. My proposal is a randomized control trial testing long-term psychosocial effects of different 12-week interventions, including one-on-one counseling, peer support, physical activity program, and the control group, just carrying out the normal survivorship care without psychosocial interventions on young adult Hodgkin's lymphoma survivors over a period of 3 years. The dependent variables in this study that will be measured will be the six issues that were already discussed. They do have standardized surveys that have already been established and are used in the real world, increasing validity, decreasing bias. There will be a baseline measurement, and then it will be repeated 6 months after intervention, as well as years 1, 2, and 3 once a year. Feasibility, not too long of a commitment. There is a multi-site study opportunity, so patients won't be locked into the proximity of one location. There will be options for telehealth, for counseling, peer support, where they wouldn't even have to leave their home. Funding options. This is also are always a point to navigate with research studies as a whole, but this is such a demanding field right now that there's a lot of grants out there looking to fund this type of research, as well as opportunities exist to connect with other larger organizations or universities out there, which will increase resources. And then I do think this is ethically sound as there will be clear and detailed information provided on what participation entails, benefits, risk. There'll be informed consent. Data will be confidential at all times, and then there will be communicated freedom to drop out at any point, even though that's not the goal. And then there'll be monitoring throughout all interventions to make sure there's not any actually additional stress added to any of these patients. And here's my summary, just reiterating the need for this, especially with this age group having such a high survival rate. They have a lot of life left to live and really need help thriving and navigating a connection back to the life they once knew before diagnosis. My refined research question is how do psychosocial follow-up interventions, in addition to standard care, affect the long-term psychosocial outcomes of young adult Hodgkin lymphoma survivors compared to standard care alone?